Are air bubbles in my GLP-1 injection pen safe or harmful? Small air bubbles in GLP-1 injection pens are safe because subcutaneous injections deliver medication into tissue where air is harmlessly absorbed, not into blood vessels. If you've noticed air bubbles in your GLP-1 pen, you're probably wondering if they're dangerous or if you need to do something about them. Let's clear up the confusion. Here's why this matters. Millions of people use medications like Ozempic, Wegovy, Mounjaro, and Zepbound for type 2 diabetes and weight management, and seeing bubbles in your pen can be alarming. But understanding what's actually happening can help you feel confident you're using your medication safely. First, the good news. Small air bubbles in GLP-1 injection pens are safe and pose virtually no health risk. Here's why. These medications are given subcutaneously, which means they go into the tissue under your skin, not into your bloodstream. Any tiny amount of air that might be injected is simply absorbed by the surrounding tissue. It doesn't enter your circulatory system. So where do these bubbles come from? Usually it's just temperature changes. Your medication is stored in the refrigerator, then warms up to room temperature. That temperature shift can cause gases to become visible in the solution. Bubbles can also form when you attach a needle or handle the pen. It's a normal part of the process. Now here's something important to understand about different types of pens. Single-dose auto-injectors like Wegovy, Mounjaro, and Zepbound don't require you to prime them or remove bubbles. They're designed to deliver the correct dose even with small bubbles present. Multi-dose pens like Ozempic need a flow check, but only before the first use of each new pen. After that initial check, you don't need to remove bubbles before each injection. The pen mechanisms are specifically designed to deliver accurate doses, despite those small bubbles you see. That's built into how they work. Let me be clear about what you should never do. Don't try to transfer medication from pre-filled pens into syringes or other containers. This can compromise sterility, affect accuracy, and potentially damage the medication. Always use your pen exactly as described in the FDA-approved instructions for use that came with your specific product. Now, if you're using a vial or a compounded product, this video doesn't apply to you. Don't rely on general videos for those situations. Get step-by-step instructions directly from your prescriber or pharmacist because those products require different handling. Here's what you should do with pre-filled pens. Always use a new needle for each injection. Follow the instructions for use that are specific to your medication. And if you're using a multi-dose pen like Ozempic for the first time, do that initial flow check as directed. When should you actually be concerned? Contact your healthcare provider if the medication looks cloudy, discolored, or has particles floating in it. Those are signs of a problem, not just harmless air bubbles. Also, reach out if you experience any unusual symptoms after an injection. And of course, if you have any questions or concerns about your medication, that's always a good reason to call your doctor. Remember, this information is educational and doesn't provide dosing or procedural instructions. Always consult your healthcare professional for advice specific to your situation. They know your medical history and can give you personalized guidance. Let's recap. Small air bubbles in GLP-1 pens are safe because these medications go into tissue, not blood vessels. Most pens don't require bubble removal, and they're designed to dose accurately anyway. If you have a vial or compounded product, get instructions directly from your prescriber or pharmacist. Contact your doctor if the medication looks abnormal or you have concerns. Have you had questions about using your GLP-1 medication? Drop them in the comments. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.